The pharmacy that we normally knew, or the traditional medicine, it's killing us. We're going to talk about the future, the power of stem cells.
I'm a big fan of stem cells, but real stem cells, and peptides, not favabine peptides.
You're a peptide addict.
I kind of am, yeah.
This program is more than a podcast. It's a weekly blueprint, a step-by-step system to help you reverse your age from inside out.
Every episode, we'll share one actionable principle, something you can start doing this week. Small steps that build a younger, stronger version of you.
Hello, everybody. Welcome to the third episode of Reverse Your Age. I'm here with Robin Littlewood. I'm Dr. Saucillo, and today we're going to talk about the future, the power of stem cells, because they are here right now. So we are having a lot of clinics and some hospitals that offer that type of treatments. But first, I would like to introduce and see what do you think at the beginning, maybe 15 years ago, when you start to hear about stem cell therapies?
You know, the first time I think I really heard about stem cell therapy was when I met you, which was 10 years ago.
10 years ago.
Yeah, and I had heard about something called stem cell facelift.
Okay.
And I went to I went to see Dr. Saucillo about a stem cell facelift, and I knew you were an honest man because he told me at that time that there's nothing to do with the face. But now we actually do use them in our face, but at that time,
not for a facelift, because it can be a little controversy because it's more to repair tissues, to improve the quality of skin. And I don't know what you think, but we can find a lot of products in the supermarket or even in platforms of cells, and they said, oh, we have this cream with stem cells, we have this stem cell patch. Have you ever heard of it?
Yes.
What do you think about
I think it's nonsense.
Nonsense.
Well, there was actually, I looked up in the there was a PubMed article on that product. But it was an N of 30, and it was obviously sponsored by the multi-level marketing company that would developed it.
Okay, 30 people in
there was 30 people in the study, which is the minimum that you need to call it a study.
Yes.
Right, an N of 30, and it was just rubbish.
I think it's a little low number one, and number two, I think they were the employees of the company.
Precisely. That's exactly what was going on. And, being an influencer, you get a lot of phone calls from people and offers from people wanting you to sponsor their products. And I just don't.
Thank you so much. We appreciate that.
Well, I mean, I sponsor, I
some things.
Yes. Yeah. I'm a big fan of stem cells, but real stem cells, and peptides, not favabine peptides.
You're a peptide addict.
I kind of am, yeah.
But we have a different type of stem cells. And where we are talking about this type of treatments or this type of cells, we need to know where they come from, because it's a little bit risky if you get a vial, maybe with some powder that we don't know what it's inside, and if we don't have the enough information, will be create a problem for the patient. So the first thing is security, okay? And it's very important to me to share this because Mexico, Panama are the only two countries that it's allowed to do this type of treatments legally, okay? As always, in the laws, we have some areas that we can going through swimming very comfortable, but that doesn't mean that you can do it. We have other countries that they do it, like Singapore. We have Japan and
Costa Rica.
Costa Rica, yes. So when we are talking about stem cells, we have to know the source of the stem cells, okay? We can find it everywhere in our tissues and organs, but there's organs that have more stem cells. We are talking about in 1 cc from fat tissue, we can find maybe 1 million, okay, of stem cells. In the past, we use some protocols that we do an extraction of the fat tissue, wash that fat tissue, add some enzymes to kill the collagen that it's into the tissue. And after that, we get a small amount. We call it the buffy coat, okay? And the buffy coat, it has that stem cells. They taken on a syringe, and we can inject it into the face. We can inject it into the joints. But what's the problem here? The number, it's not enough. In some places in the States, they keep on doing like this. And you make a combination with rich platelet plasma with PRP, but the results, it's not good enough. So I'm trying to share that information, because normally we can confuse patients. I don't know if you, when you write your articles, if you have any that type of questions that are a little bit confused, if we get it from a laboratory or from their own.
Yeah, well, people are confused, I think, about the different types of stem cells that are available, which are mainly using mesenchymal type cells, which are coming from either from placenta or from
umbilical cord.
From umbilical cord. Then you can also get, I've done both of those. I've done placental and umbilical in my back and my hips. And then I also did my own bone marrow cells, where they extracted the bone marrow, and but they multiplied my cells. So that's the difference.
That's the difference, yes.
In Mexico, you're allowed to multiply. In the United States, you are not. Not for any good reason, by the way. Because it makes it less effective, because you are getting less cells. Yeah.
And how was your experience with the treatments? Because you told me I feel good. So
yeah. I was pretty much crippled by years of bodybuilding and doing stupid things like jumping off of mountains with sticks on my feet. I had destroyed my L5 S1.
Okay.
And it wasn't destroyed. I mean, I still had some tissue in there. So that was the first thing. It was very painful. And I was taken, basically I couldn't work out anymore, which was suicidal. That was the first procedure I did, and I got immediate relief.
Okay.
Yeah. They put hyaluronic acid in with it and some ozone. And I did do more than one treatment on that joint, though, because it was so destroyed. I think I did 2 or 3 treatments on the L5, and that's perfect now. And then when I fixed that, my hips started to hurt, probably because it tightened my back, and so the hip flexors were. So I did my hips, and then I've used it since then for my face.
Okay.
Yeah. So we've fixed the technology to the point where we can use it.
And you did intravenously with me too.
Oh, that's right.
Yeah.
Don't let me forget.
No, we had that experience with umbilical cord too, mixed with exosomes and some interleukins. We will be talking about this in other episode, but it was amazing, because now with that technology, we are receiving and having secure procedures. In the past, as you told us, it was a little bit aggressive, because they have to do the extraction from the bone, and they has risk. And one of the risks is infection in a bone, and it's a big problem. Yeah. So,
and I wasn't allowed to work out for a week, which for me is a problem.
Right. Yeah, for sure.
Then I have a bad week.
After we start with the new technology, where they develop in the laboratories new tools to see the quality of that stem cells, because it's not only to get the tissue and make the multiplication. You see it into the microscope, you can see the quality and you can see the number. How it works, okay? They get the tissue, they make the extraction. After that, they start the harvest. And they have small boxes of glass doing the multiplication of that cells. And after that, they take a sample. With the sample, they can see into the microscope the movement of the stem cell and the quality. If the stem cell has change of structure, anatomy, or movement, that's gone. Yeah. And they have to do it with a new harvest. That's very important, because normally, and I have to be very honest with you and with you too, there are some places around the world that still using that samples that it's not good enough. So, and that's why we can find some products more cheap. Okay. So we have to ask a lot of things, but one of them, it's okay. Your cells came from a lab. They have a permit, they have license, and I will get a certificate of my samples too. So that's very important. When another question that normally patients ask me is, okay, if we are going to do from a donor, I'm a little bit worried, because if they have a chromosomic thing or condition, or maybe the virus, hepatitis, we have a lot of disease and a lot of microbiology disease. So the answer, it's very transparent for me. they do, once they get the tissue, before to get the cells into the vial, they do the same. They run a lot of tests that is related for that. So that's part of the security.
So if somebody was to get a stem cell from
Mhm.
somebody who had hepatitis, that would pass into the other person?
Yes, if they but not for the stem cell.
Yeah, because the stem cell I would think would be
Yeah.
that hasn't differentiated.
It's the whole vial and everything has to be sterilized and clear.
Oh,
Okay.
well, that makes sense.
Yes,
Yeah.
because we normally in the process, I always say we have to trust, because you don't see that process. I've seen that process a lot of times, but as a patient, you have to trust to the system, you have to trust to your doctor, and you have to trust to the clinic. And in your case, they have to trust you, because you have did these treatments in the past. So, but they have all the tests. That's not only for me or for my clinic. It's for a lot of clinics around the world.
So this is the stem cell bank where you get things from. It's Guadalajara, right?
We have a laboratory in Guadalajara and Tijuana, and it's the biggest one that we can find in whole Latin America. So they're working in a lot of things to get the best quality of stem cells. And it's getting improved, all the process, which is amazing, because we can see results more fast than normally. Okay. And now the question is, that create any change on our own cells to create a cancer? Because that's a question that normally they do.
Yeah. Well, my understanding of cancer is that, stem cells wouldn't cause it.
No.
So zombie cells could cause it, because you've got
that cells are very strong into our system, and
damaged cells replicating. But I don't really think that has there ever been a case of anybody ever getting cancer from doing stem cells? I don't think
no. We have there's an article, a medical article that I read maybe 5 years ago, and it was from a clinic, but not only for it wasn't a problem for the clinic. It was a clinical trial. Okay. Mm-hmm. And they inject embryonic stem cells into the back to a patient, and he created teratomas. That's a tumor, but it's not cancer. So the behavior of that cells, embryonic and fetal cells, are not controlled enough. So that can create new cells. Imagine you can create a baby with embryonic stem cells or embryonic cells. Imagine what could happen in our body. So we have to be very careful. And actually, here in Mexico and Panama and the rest of the all American continent, it's illegal. Okay. For some reasons, it's illegal. Okay, there are some places in Asia that it's legal, but I'm not completely sure that we are ready for that. I don't know where I think it's in
the iPSC, or the induced pluripotent stem cells are available here in Cabo, but I don't know. I haven't heard of any adverse events from those either, actually. Mm-hmm. But then I don't know. Would we hear about it? I don't know. But there's 2 big clinics that are doing that right now in towards San Jose. So I haven't heard of any adverse events yet.
Me neither. But
I mean, potentially when they use all 4 of the Yamanaka factors, there is the potential for teratomas.
Yeah, for sure.
It may not be cancer, but it's nasty.
But it's a tumor. It's a yeah. You can name it. You can name it if you want.
Your pet rock. Yeah. So I could do without that. But I haven't had, for myself personally, I've never been afraid to try stem cells. I mean, it was never even crossed my mind that it would be dangerous.
Okay.
I totally trusted the doctor that did it, and I totally trust you. Mm-hmm. So and that's my 2. Well, I've had 3 doctors do stem cells.
And the next question will be, but how it works? Because we think about our environment, it's the perfect one, and we want to fix some process in our system, but the reality is, as we always talk about inflammation, about our environment, our diet, which is very important. If we do the treatment and we are not prepared, the stem cells can work or not. But if you are changing that habits and changing a lot of things around the stem cell therapy, you will see the results more faster and improve for a long term. But one of the capacity of the stem cells is regulate your immunological system, which is very close to immunological disease, and also can decrease the inflammation. If we do it locally, imagine we have a patient for joint pain, we can inject it directly. That will decrease the inflammation, and the movement and the function will restore the capacity to work out or maybe movement, because they want to be closely to improve the quality of their lives. And it's very difficult because we are full of painkillers around us, and we take it like gummies, and that block a lot of process to create new stem cells, to create, I don't know, exosomes and a lot of products, NKs even.
Okay.
So that's the pharmacy that we normally knew, or the traditional medicine. It's healing us too. And I'm a doctor, I know, but I know when I have to use medication, but it's not for prevention. Medication, it hasn't been for prevention, like pills.
Right.
No?
Right. Yeah. We have a sick care system. We don't have a healthcare system. So the prevailing theory, again, last year I was at a big anti-aging conference, and all of the scientists stood on stage at the end and said that they really felt that the reason that stem cell therapy was even working was that it did boost your immune system, that was why it worked. Like that's, so there sort of, it seems like aging is really boiling down to a loss of your immune system. Your immune system stops working. You aren't catching your natural killer cells aren't getting the stuff that is dangerous, because you don't have enough of them. And the stem cell therapy is donating a lot of other things to your body besides just the stem cell. It's mitochondria, for example.
All the energy that we need.
Yeah.
However, we're still taking medication uncontrolled because we feel, and I'm not talking about you, I'm not talking about me, because I respect that area, but I don't want to fix a symptom, because symptoms are good too, okay? But if you want to take a medication, a painkiller, every single time that maybe there are people working out and they say, oh, take an ibuprofen and you will not have pain the next day, which is very dangerous, because you are taking an ibuprofen that thin your blood, that can create a cascade of inflammation after.
And your liver.
Your
liver's got to clear all that. So a lot of people that I know take tons of things like Tylenol. They're just popping them and these things are over the counter, so people just assume that they're safe, but I actually think they're quite damaging. NSAIDs as well. I just don't take them.
When you decide to do a stem cell therapy, you did some research, or only it was a trust to the doctors?
I can't remember if I did any research or not, but Dr. McGrawn was the one who fixed my first problem, which was my lower back. I can't really remember. I don't think I did any. I really trusted him because I've known him for so long. So I think I just went for it. And I'd only heard about stem cells really peripherally at that point. That was about 3 or 4 years ago my first one. So
okay,
yeah. So I didn't do a deep dive on stem cells, but I think it just sounded reasonable to me. I'm a biohacker, so I know what the alternative is going to be. I will take risks. I'm taking all kinds of different peptides.
Every day you're taking risks.
I'm taking peptides every day. I'm watching my drugstore my fridge, my refrigerator looks like a pharmacy because I've got, all these vials in there. But I know what the alternative is. And for me, it's really bad because my grandmother, my mother, my great grandmother, my aunt, all the redheads died of Alzheimer's. They already had Alzheimer's by the time they were my age.
Oh my God.
So I take risks.
But that's important to share with us, because you had the option. We always have an option. We decide not to have any disease, but we have the risk. But it's not a rule that you can develop that.
Genetics was definitely a huge part that it was played in that. But if you knew these people, you could. I can remember now that they were all. Nobody was overweight, but they were all insulin resistant because of where they were putting the weight on. They would have nothing, like they were skinny arms and legs with like a big,
With the belly,
with a
yeah.
belly, right? And everybody had problems with their microbiota. Everyone, there was always complaints about that going on, about, having problems there, which is another huge cause. They were also extremely negative people and very kind of closed-minded, very super religious people, and afraid of money. Like they had a very negative attitude. So I don't think I feel like I'm probably going to beat it. Okay. I'm optimistic that I won't get.
It's better, right? It's better to be optimistic, and also I'm not thinking. I'm sure that your attitude and your emotions related to any type of treatment or things that is happening around you, it's vital.
Yes.
Because if you don't in charge of that part, nothing is gonna work.
Well, if you're worried all the time, you're stressed all the time.
And create cortisol.
Right. And that breaks you down and it makes you fat. It does. Stress cortisol makes you fat around the middle. And it just this expectation that something bad is going to happen.
Oh my God!
Yeah,
it's really
well. And at my house, it's always like, oh, Robin's going to get Alzheimer's because everybody else did. And she forgot the car keys. If you, God forbid, you forget your car keys. It's starting. So I have to stay away.
It's normal to forget some things. Come on.
Well, whatever. But I mean, it's just there's a lot of negativity and that stuff sticks in your head. It sticks in your head.
And when we do the stem cell treatments, it's vital for me to share that we can improve for longevity purpose. Okay, when we do for longevity, we're thinking to improve your levels of stem cells to replace with these new ones, with quality and quantity too. And we combine some treatments because that will improve, and it's a different pathway to get to this big purpose, and it's to decrease the inflammation and repair the tissues. We can do it with stem cells. We make combination with the exosomes. Sometimes, if you don't have the ability to move, that can create depression in most of the patients. If you are feeling pain, you can get called depression too.
Sure.
So
sure, it'll make you angry too.
So, frustration, a lot.
You're not going to be feeling very spiritual if you're in pain.
No, nobody
does, right? So,
yeah.
And pain is an epidemic. I think people that are my age, that I bump into them, that I haven't seen for a while. I'm 60, turned 60 this year. People are really suffering. So if they worked out a lot like I did, they're breaking, they've broken themselves down and something hurts, and that was my case, or they do nothing, and so therefore they are overweight, sick, and in pain anyways. So there's even if you were an exerciser your whole life, you can still have pain by the time you're my age.
I think it's a amazing topic for a next episode about pain, and talk about pain, because we have options, and not the typical ones to do take some medicine. We can do some injections to the vagus nerve, to the stellate ganglion. Try to not to treat the patients in a chronic ingest of medications, because you can live without pain, but you will have a damaged liver, a kidney which is very damaged, and even the gastric and the microbiome that we have is going to be affected. So
yes,
I think that's important to close this episode. But Remember about the stem cell therapies. Please ask everything before to do it. Know more about and do some research about the clinics.
You don't do what I did and trust the doctor. It turned out okay.
It's part of the process, but it's not the only thing.
Hey, I knew that doctor for 7 years before I did. So that's
and you knew 10 years before when I did it.
So I have two brilliant doctors here in Cabo San Lucas. So and this thing that Jose Ramon is saying about medications, I just don't even live in that world. How I made it to this age in this condition was because I have Dr. Socio, I have Dr. Magran. These men are I would call them, they're not officially functional medicine doctors, but they act as such, and they don't give me prescriptions.
Oh.
I've never asked for one. Well, unless I had to have antibiotics when I did my
yes, it's just to be sure to not create
everything that we do is outside of pretty much the normal scope of medicine.
And it's not the traditional medicine. And
it's functional medicine.
I would love, and I want to see the times when in med school they teach this, because you can understand more and feel more empathy to the patients. And I think we are losing it in all the public health system. The attention is in. I'm not talking about service. I'm talking about medicine. Well, if you don't hear the patient, if you don't see the patient like a big picture, you are only prescribing medication.
Well, in Canada and the United States, it's worse than it is in Mexico. Mexican doctors are better for this, but in Canada, it's 15 minutes. Dun, 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 dun. They come in the door and you write you give them a diagnosis and a prescription. Here you go, next. And that's how it works in the United States too. And there's, they have the HMOs in between too, which are even worse. And it's become this machine that's just cranking out sick people. It's not helping anybody, and it's the time has passed.
I know. So I think if you don't want to feel sick and if you want to look so good like you, we have to offer and do some research about non-traditional medicine. We have options, and for me, it's always an opportunity to study a new case, to study a new patient, to get a new network and this communication with each one, because every single patient is a different whole world, and you can improve in some areas, I can improve in some other areas. And if we don't know how to do it, there's some place that we can recommend always, no? So stem cell therapy, it's now here in our world. It's working. It has to be very, very evaluate for the doctors. And also, if you are a good candidate, I'm sure that you're going to get all that benefits. So it was a pleasure to share today the third episode. Let's see us in the fourth one, and we are waiting to get a lot of information. Remember to subscribe to Reverse Your Age, and see you soon.
Thank you. So here we are. If this episode helped you, don't forget to subscribe, leave a comment, or share it with someone starting their own transformation.
We'll see you on the next week with your next evolution step and more tools to help you reverse your age.